Welcome to Doctors on Call. I'm Jenna Miller. Healthy eating is one of the best things you can do to prevent and control health problems such as heart disease, high blood pressure, type 2 diabetes, and some types of cancer. Fitness means being able to perform physical activity. It also means having the energy and strength to feel as good as possible. Getting more fit, even a little bit, can improve your health. If you're having trouble losing weight, what about physician-assisted weight loss? These programs are designed to help patients overcome their weight loss challenges in a safe, healthy way that includes a customized diet plan, exercise routine, prescribed medications, and medical supervision to help promote healthy weight loss based on their individual needs. Weight loss, that's our topic today on Doctors on Call with our guest, Dr. Crystal Hill.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Our topic tonight is weight loss with Dr. Crystal Hill. Dr. Hill received her medical degree from the University of Kansas School of Medicine and completed her residency at Via Christi Regional Medical Center in Wichita. She is board certified with the American Board of Family Practice and American Board of Hospice and Palliative Medicine. Dr. Hill is a member of the American Academy of Family Physicians and the Kansas Academy of Family Physicians and is a provider at Pawnee Valley Medical Associates in Larned. Give us a call at 800-337-4788 toll free with your medical questions about healthy eating and exercise today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much, Dr. Hill, for coming and joining us tonight. Let's get going with some questions right away. First of all, let's talk about what, if there's an answer to this question, what is the best way to lose weight?
Yeah. First of all, I just want to say thanks for having me. It's quite an honor to be here. And I just want to say hi to everybody in Larned and all the staff I have. They're great. So, but in answer to your question, it's a great question. But you know, there's no one good way to lose weight, and there's no one way for everyone. And so really weight loss is a natural effect of healthy eating and healthy movement habits that are sustainable. And so being overweight and having too much fat is really the effect of not having those habits. It's not really the main problem. So the main problems are, there's a number of them, and so you have to start working one by one to start changing your lifestyle. So I've had a number of patients that have come in with different areas that they're struggling with, and really you can only work on one thing at a time. And so that could be, somebody might be having struggle with planning their meals, or they don't know what a serving size is. They don't know much about nutrition. So we can help them learn about all of those things. Improving healthy eating habits, behaviors on eating. So trying to eat more slowly and be mindful of how you're eating and feel your fullness and your hunger, and feel your appetite. How full are you? How hungry are you? When are you hungry? When are you not hungry? Those sorts of things. There's just a number of things that we can go through with each patient and try to figure out what their roadblocks are. And we really only try to work on maybe one or two things at a time, because we really can't work on a bunch of things at a time. But there's just no one thing that's going to work for everybody, except for the fact that it's building healthy habits on nutrition and healthy habits on movement. And then the natural effect of that is the weight loss.
Sure. There are so many different fad diets, diet plans out there, the meals that come to your home. How does a person know what's right for them? Are any of those right?
Mm-hmm. Well, really fad the fad diets that are out there, you know, the thing that they do is they help patients, they make it easy. They make it easy from the beginning because, and they will work because they have the advantage of saying, okay, this is what you can eat and this is what you can eat, and it makes it simple. And so it does making that change a little bit easier. And so in the beginning, I think there will be some success if people follow these rules. But the problem is then you run into having that early success, and then after a while you're cutting out certain things from your diet, and so your body starts having cravings. And then you're going to start getting into an overeating phase or cravings that you can't get past or roadblocks that you can't get past. And then maybe you have a little disappointment because either you're gaining the weight back or you're not losing weight anymore. And so then you kind of fall into that trap where it becomes a cycle. And so then you're like, okay, I can do this. Then you get back on the wagon again, so to speak. But then you start, you know, it kind of takes a toll on your mental health because you're like, well, why can't I do this? I should be able to do this. And so, again, it goes back to creating healthy habits of nutrition and exercise or movement that are sustainable, because you want to make it so that you're not necessarily doing something that you can't continue for the rest of your life, because then you're going to fall back into that trap again of possibly not being able to keep it going, and then gaining the weight back, and then finding yourself either back where you started or even worse. You know, sometimes people find out that they're heavier than when they started, and that's even really hard. You know, so
Can a person be successful at losing weight by maybe keeping the diet that they have but just cutting back on everything?
Right, yeah. So, you know, I like to work with people when they come in. It's one of my favorite things about my job. I like to work with all patients, but I especially like to work with these folks because I tailor it to their individual needs, and so everybody comes in at a different phase or a different stage. And some of them already have kind of like, okay, I know, like, I'm eating 1,200 calories, and they're sort of got a little bit of their nutrition figured out or whatever, and we find another roadblock that they have or struggle with, and so we work on that. But some people come in and they're sort of lost from the get-go, and they're like, I don't even know where to start. So then we sit down and we look at, you know, their medicines, we look at their medical history, we look at their medical problems, and we look at, you know, where they are, and then we can come up with a plan, you know, based on their weight and their age and their, you know, their height and all that sort of stuff. We can figure out what maybe a good target for them would be to start out with. And so, it's different for everybody, though. It's not going to be the same for every person. So,
What medically assisted weight loss options are there?
well, you know, a lot of people, when they think about medically assisted weight loss, they think about things like, you know, dramatic things, kind of like bariatric surgery or, you know, very low calorie diets. I was just talking with one of my patients today about a 800 calorie per day diet or something like that. And these things, again, will work, and if you're monitored carefully, you can do those for a short time. But what I'm more into, again, is working as a partner with the patient and being the person that they can come to for accountability and to help them get started, figure out, you know, where they are, where they want to be, and maybe get started on the road to get to where they want to be. And so we start with the nutrition, and then, you know, we also have some patients who want to try some of the medications, and I know some doctors kind of shy away from weight loss medications, but I think they do have some benefit in the short term, because you know, we all need a little bit of a boost sometimes in helping ourselves stay on track, and so some of the medications that I prescribe do that. There's various different ones. There's ones that can help with appetite control, and ones that can help with craving control, and some that help stabilize blood sugars, and some that even just make you feel fuller. without, you know, a stimulant effect. So there's a wide variety of medicines out there now. And they potentially do have side effects, and so that's why it's very important to work with a trained professional to make sure that, you know, they know what your medicines are, they know what your medical problems are, so that you're not taking one that's unsafe for you.
Now, if a patient is on a prescription drug to help with their weight loss, typically how long do you like to have them on that med before they go ahead and wean themselves off?
Right, right. I would say the most common medicine that we use for helping people lose weight or jumpstart their weight loss, I guess you could say, to get into those healthy habits is short term. So it's like 3 months, maybe a little longer if they're still showing progress. But generally it's kind of around 3 months. But that being said, there are some FDA approved weight loss pills out there now that are, or weight control, I guess I should say, that are made for more longer term use that you can be on for longer term, because they're the ones that aren't in the stimulant category, so they're safer to take longer term. Yeah.
And how do you know if you're getting the right amount of vitamins and nutrients in your diet?
Well, that's another good point, Jenna, because as a, you know, working with a physician, we can check some of these things. Okay, so we have the ability to do laboratories, and we can like check vitamin D levels, magnesium levels, B12 levels. There's just a variety of lab tests that we can do to see if there's any missing nutrients. I mean, obviously we can't check every nutrient under the sun, but you know, we can check the big ones and make sure that you're getting what you need, and if you're not, we can supplement for those. So
sure.
Yeah.
And in your practice, what have you found to be the most successful for a weight loss program?
Well, I think everything is pretty successful. I mean, really, it comes down to what I said before. Weight loss is a natural effect of sustainable, healthy eating and movement habits. And so whatever road we take to get there, that's the most successful. And it can be any number of roads. But that's really what it boils down to. And most people are kind of hoping for that magic pill or that magic wand. And you know, I mean, we do have, like I said, we have some things that can help you stay on track, but there is no actual magic to get to the healthy habits. We have to work to get there. But you know, I can work with people at finding their struggles. You know, they come in and they say, well, I'm really struggling with this. Any ideas of how I can get around it or get over this hump? And we can work one-on-one together to keep moving forward. And the other thing that I wanted to mention too is that weight loss is going to be slower than most people anticipate. So it may come off pretty quickly at first, depending on how overweight you are. But at some point, there's going to be a lull or a plateau, and everybody that loses weight has this. And so, and that's when a lot of people get frustrated, and sometimes people might even regress or quit or give up. And if you have a healthcare provider or a physician on your side helping you, then this is, you know, going to your success is, you know, you're more likely to be successful if you have someone helping you. So,
do you ever start a patient on a certain program and midway between you're thinking this is not working?
All the
and then have to,
time,
okay.
all the time.
So what do you do in that situation?
Yeah, I mean, I have, sometimes we start folks on a certain calorie target and it's not working for them, so we tweak it either up or down depending. And you know, like I said, I'm not really a big proponent of those very low calorie. I really don't want to see anyone eating less than 1,200 calories a day, but depending on how active they are and whatnot. So we can tweak their calorie targets, we can tweak their protein intake. I've been really big on protein intake lately because I really found myself that it's really important for keeping your lean mass. And that was something that in my journey, my own personal journey, I've neglected in the past. And so I really talk to patients a lot about eating more protein than you would expect to have to eat. Like maybe for an average female, 70 to 90 grams per day, which you have to try. I mean, you're not just going to naturally usually get that much, so you actually have to try to eat that much protein. So things like that. And then from the medicine side of it, there's times when we start people on certain medicines that either they don't like them, it doesn't agree with them, they get a side effect, or in regards to some of these stimulant medications, it's they hit a plateau, it quits working for them, or it's just simply time to wean them off and try something different. And at that point, we can either take them off the medicine completely, or we can switch over to something different. And I've done it any number of ways. And then there are also times where I've added on a medicine in addition to one we've already been on. So again, it's very patient specific. It really is. So yeah.
Excellent. That's good to know.
Yeah.
We want to remind our viewers that we are talking about weight loss today on Doctors on Call with our Dr. Crystal Hill. If you have a question for her, you can call us at 800-337-4788. We hear a lot about keto and paleo.
Mm-hmm.
Your thoughts?
Mm-hmm. Well, you know, I really think, again, these diets are going to give people a structure, right? So, and myself, I had a point in my life where I thought, okay, I need to change my nutritional habits because I'm not getting where I need to be. And the paleo diet was very attractive because it allowed me to have certain things that I like and that I didn't think I could give up, but yet took away some of the other things that I thought were causing me problems. And so I think for some people, they really look at certain diets and say, oh yeah, this is it. This is the one I think I can do. And I don't necessarily discourage people from that. If they're pretty set on doing a certain diet, I say fine, go ahead and give it a try. But at some point, it's going to be difficult to sustain. And so then we start coming up with different regimens or tweaks, trying to make it work for them. Because again, you can start doing things one way and the body is so sneaky that you have to change it up. You have to change it up, because if you don't, if you just keep doing the same thing over and over and over again, the body adjusts. And so every once in a while you have to tweak things and change things up. And so, and again, you can get into that routine I was talking about earlier, where if you do a fad diet and you do really good for a while, and then all of a sudden you have, say you're on keto and you have graduation and you have birthday and you have wedding and you're eating cake and carbs and stuff that you wouldn't normally eat, well then all of a sudden you're off the diet and you feel, oh darn, I'm a big giant failure. Well, that's not necessarily the case. It's just the fact that that's such a restrictive diet. It's just going to be hard in an everyday lifestyle.
Sure. So. Well, we're going to go to the phone lines. We've got Kathy on the line from Cordell. Hi, Kathy. Go ahead with your question for Dr. Hill tonight.
Yes, I'm wondering about like Nutrisystem or Weight Watchers, the different foods. Can you keep the weight off by quitting once you've lost what you want? If you stop, is it a guarantee that you're going to gain weight?
Well, that's a very good question. I think that there's some expectation that once you stop any sort of program that's very regimented, that there may be a little bit of shift there where you may have some struggle with that as far as gaining weight back. But the key is that you want to make sure that you're learning what you can learn from those programs about the healthy eating habits and the nutrition habits and the movement habits. And so with Nutrisystem, they're going to have a pretty strict food regimen that they're going to send you. And I had patients actually that came in and said that they started with Nutrisystem because they were in a busy time in their life and they found it easier for them to just sign up for the meals and have them delivered to their door. So they were, pretty sure that the meals that they were getting were exactly what they needed and healthy, and that could kickstart their program. But then after a while, it gets expensive and things like that. And so what they did is they made sure they learned from what they were getting so that they could continue those healthy habits. And that's really what you need to do and you can tweak it so it fits you, but you have to make sure you're kind of continuing that healthy nutrition throughout and making sure it's a sustainable thing. And same with Weight Watchers. They're trying to teach you how to have a healthy nutrition regimen. And that's not to say that you have to do it exactly that same way forever, but they really want you to eat a certain amount of proteins, a certain amount of carbs, a certain amount of fats, et cetera, et cetera. And so they're really trying to teach you those habits and ingrain into you what those healthy habits are. And so, again, you can tweak them to sort of fit your lifestyle, but within those healthy, eating habits, you really need to sustain those for, ongoing, forever, kind of, just plan on doing it forever. So it really shouldn't feel like a diet after a while. It should just feel like your normal everyday routine, like what you eat. This is what I do. This is my normal, And then you're not likely to gain all of your weight back. You still, there might be a little bit of an adjustment, 5 or 10 pounds, but you're not likely to gain everything back.
That's interesting that you mentioned that again. You had also said that sometimes you'll find people will gain more.
Yeah.
Why does that happen?
Well, it happens because they feel so restricted in what they're doing by their regimen that they're doing that they haven't made it part of their lives. So, and so once they stop doing that thing, they just go back to the thing that they were doing before, which obviously wasn't working for them in the first place because it got them to where they were. And then sometimes, as I said, that cycle where it takes the toll on your mental health, you feel like, oh, I don't know what's wrong with me. I'm just such a failure at this. I can't do it, and it makes it even more devastating. And so I think sometimes people become even more depressed, even or something like that, because a lot of people do end up gaining more weight back. So it kind of starts a little bit of a vicious cycle in a way. And so that's why I keep saying, harping on, anybody that talks about nutrition is probably going to say the same tune over and over again, but weight loss is a real natural effect of healthy eating and movement habits that you just make it part of your life. You just say, this is me, this is my life, this is what I do. That doesn't mean you have to do exactly the same thing every day, all the time. You can tweak it up. You can do different movement activities, you can eat different foods. But within that, you're basically going to be eating the same amount of calories, or you're going to be moving the same amount every week, that sort of thing. And it's just going to become a habit for you for the rest of your life.
How does a person know if medically assisted weight loss program is for them?
Well, I think I could help about anybody, actually. So, but I think if anybody's been out there struggling, not knowing where to go next, those folks that have I have had a lot of folks come in recently that have been successful on their own, doing whatever thing that they were doing, but then they've sort of hit a plateau. I like to see them come in because I like to brainstorm with them and help them through their roadblocks and help them come up with fresh new ideas. And sometimes we talk about whether or not a medicine might help kickstart them again, that sort of thing. And so really, anybody who's struggling with losing weight, it can help out anybody. So, yeah.
Excellent. Now, what about exercise? How important we've talked a lot about eating, how important is to integrate exercise into all that?
Well, I think exercise is important, but it's not the main thing. The ADA says that you should get 150, the American Heart Association says that you should get 150 minutes of moderate exercise every week, right? Or 75 minutes of vigorous exercise every week. So obviously they think for your heart health and for your overall health, they think exercise is pretty important. And so we talk about movement habits obviously being important, but really when you're losing weight, naturally people think, well, I just need to exercise more. You know, I have that cheesecake and then I'll just burn it off on the treadmill. Well, that's not really the case. Really, the nutrition habits are probably 80% at least of where you're gonna lose most of your weight. So you've got to get a control on your nutrition habits first. 20% of your weight loss is going to be from your movement habits. So that being said, movement habits and strength training are important for your overall physical health, but you're not going to be able to, what is it, you can't outrun your fork or you can't outrun your bad nutrition habits. So you can't just exercise your way out of a bad eating habit. So, yeah.
Okay, all right. And anything else you'd like to help with any patient out there who might think, I might want to try this? What's your advice, real quick?
Well, I myself had a weight problem. I feel very compassionate towards people who are struggling with their weight. I really enjoy helping folks. I really enjoy meeting people, and this is one of my favorite areas to work with folks on. So, I don't know. I just really like this topic. So, it's just one of my favorite areas.
Wonderful. Well, thank you so much for joining us tonight and for being our guest. And thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.